Hi, everybody. Thank you for having me here today. Again, I'm Dr. Jason Nardi. I'm a neurostructural chiropractor and a functional medicine practitioner. I'm going to be talking about something that should be important to all of us, your health. I want to start off by thanking everybody, and I want to be upfront and explain that I'm not here to sell anything, but as a thank you for attending, I do want to give you all an opportunity to have a consult with me at a discounted rate. We'll talk more about that at the end, and you know, as a second bonus, I do want to send you all out a free ebook as well. I hope that will be something that's appreciated and well shared amongst your friends and loved ones. What I'd like to also discuss is why we do these online webinars. We do these to raise awareness of health problems, not only in individuals' health, but within the health industry. We like to kind of make people more aware of what's going on. It's the only way things can change. The other reason why we do this is to raise awareness of what we do in our practice. We do see patients from all over the area. We see patients from up and down the East Coast, and we are very willing to expand that territory as well. So what I'm going to be talking about today is how somebody can have normal labs and still not be healthy. To get started with that, I want to talk to you guys first a little bit about what we're going to cover, and that's what health is. We're going to talk about the difference between medical care and wellness care. We're going to discuss a little bit about optimal health and what that means. And so you don't think I'm trying to badmouth medicine, I want to explain to you why you may not have heard this before. And to close, I'm going to talk about a few things that you can start doing tomorrow that will benefit your health and get you on a track to being well. To start, though, I need to cover a few facts. We're not a healthy country. We rank very poorly for the richest nation in the world. The World Health Organization puts us at 38 out of 191 countries. When we compare that to the wealthiest 11 nations, mind you, I didn't say 10, the top 11 nations, we're 11. We don't make the top 10. We're not even in that. So that's not very good, especially when you consider we outspend those 10 countries combined in their healthcare costs. We have the worst infant mortality for a developed nation. We come in at 167th in the world. It's safer to have a child in Botswana than it is to have a child in the U.S. But we spend $3.2 trillion a year, or $10,000 for every man, woman, and child on U.S. soil. And we're really not getting our money's worth out of this. If we look at this as far as life expectancy versus healthcare costs per country, you can kind of see we're not doing very well. You know, here's the typical line. You know, the more you spend, the more likely you're going to have better results. You know, India's spending very little. People are living to about 66 years old. Mexico, they're spending a little under $1,000 per person, and people are living to be about 74. You get into some of the healthier countries like Italy and France, the two top healthcare systems on the globe. You know, Italy's spending $3,000 per person, and they're living well into their early 80s, where France is spending a little bit more than $4,000. Here's the U.S. We're the big outlier, and we're actually now over here. This is old data. We're not even on the line. We're the biggest outlier here. Well, the average American is living to be 78 years old, but we're spending $10,000. We're spending 10 times more money than Mexico, and we're only getting 4 more years of life expectancy. That's not a great return on investment. So what is health? Health doesn't mean not being sick. Health is really about optimal well-being. It is about a whole body approach. Dorland's and the World Health Organization, Dorland's is a medical dictionary that you would find in any doctoral program, whether it's an osteopath, medical, or chiropractic doctor. It defines it as an optimal state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. The World Health Organization did not expand on this. They actually shrunk it down a little bit, but they said health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So it's not about being just symptom-free. Symptoms aren't really the most important thing, and are usually the last thing to show up in sick people. I try to tell people all the time that the first symptom of having a heart problem in 2/3 of the people is death by massive coronary. So, symptoms aren't something that we really have to concern ourselves overly about, because they're the last things to come. Now, granted, you need to manage those to have a happy patient, but it doesn't necessarily mean it's a healthy patient. So our healthcare system isn't set up for health. It's set up to manage diseases and illnesses. It's really disease care. When we go to the doctors and have blood labs drawn, glucose or blood sugar is a very common test to have, is usually flagged at 120, depending on the lab. Once it's flagged, that's considered a problem. A blood sugar result this high would generally require prescription medications that most patients are on for the rest of their lives. Analyzing results in this way is standard disease care. Identify a disease condition, prescribe a medication. In our office, we flag glucose above 95. It's an early warning sign. Most doctors wouldn't take action until it was over 120. However, health statistics have shown if your blood sugar is 100, you have a 96% chance of getting diabetes in the next 10 years. I don't think anybody wants to wait to get diabetes to actually take action. And I will say, too, as a testament to some of the doctors in my local area, a lot of times now, patients are being counseled when their blood sugar is hitting 100, 105. So we're seeing some changes for the better in the healthcare profession as a whole. This is the reason why we look at labs, right? Blood is life, and healthy blood means having a healthy life. So in our office, one of the things that we do specifically with labs is we break these labs down. So not only are we looking for clinical and early warning signs, but we also want to see how well things are working together. Remember, health is about an optimal state, and it's about many different levels of existence. The same thing with blood. We can calculate how each area is working in the body and what level of health concerns there might be for those areas. These are two recent charts from a recent patient report that we gave just last week. You can see how certain areas are out of functional ranges, and the graph next to it will talk to you about the highest concern to the lowest concern. So in this patient, we have some cholesterol problems, we have some electrolyte and acid-base problems, some hormonal and immune problems going on, and some inflammation and cardiovascular problems, oxidative stress, which are kind of all really tied in together, and some blood sugar issues. Well, what are the health concern rationale? What might be causing these things are possible bacterial infection being the most, metabolic problem, metabolic syndrome, which is a combination of having cholesterol out of optimal ranges, having some high blood pressure, having the inability to manage glucose and insulin together. This is what we determine as a metabolic syndrome, or syndrome X, they also call it. So you can see all the way down the line to, this was a male patient, to prostate problems. We look at all of this from a lab. So when we talk about this and being in optimal ranges, what we mean is, well, we're looking at stuff not really, are we really high or really low, but are we within that normal range that the lab calls normal? Or are we kind of not working in the right balances? Back in the 80s, a bunch of medical doctors had the revelation that all of our labs, for the most part, have been taken from sick people. Most people weren't giving very large panels of blood when they were healthy. So they decided to survey a bunch of healthy patients, and they defined healthy as being the right weight for your height, having no diseases or infirmities, and being on no medication. And they looked at the ranges of healthy people's blood, and they saw that that range shrunk down. So we just kind of tightened those numbers up. So being in that range is being optimal, having optimal health. Living optimally means catching problems before they happen. Prevention goes a much longer way than management. Not being ill, even having subclinical indicators, can take can take a toll on your body and the cells that make it up. The cellular stress can cause anything from cognitive decline to advanced aging. And you can see here, looking at blood in this way, we can prevent a lot of things like diabetes, heart disease, dementia, hormonal changes, chronic inflammation. And as an anti-aging factor, we're keeping your cells healthy, we're keeping your hormones at optimal levels, metabolism going strong, reducing inflammation, and keeping the brain sharp. These are all important parts of having an optimal life. So a lot of my patients ask why they haven't heard about this before, and we also see a handful of healthcare professionals in our office. It isn't because your doctors aren't smart. They are. These are very well-educated people. They went through a lot of training and a lot of education to become your doctor. However, the idea behind medicine is managing patient symptoms. And as I said earlier, that's not the really best approach. We have a serious shortage right now, too, of primary care physicians. A regular general practitioner's office might see 50 people a day for one provider. Looking at early signs, looking at wellness, making lifestyle changes, this takes time. It takes time that these physicians don't have. They're more concerned about the little girl with a strep infection or their patient who's coming in to get his heart meds re-upped because he can't manage his heart disease without them. So the other problem too is this is a different type of work. A lot of people aren't aware of it because, well, insurance networks don't pay for it. And insurance networks dictate a lot of what goes on in a general practitioner's office. Functional medicine is considered preventative and therefore not covered. It also takes years to learn this stuff. Hundreds of hours of postdoctoral training is required to become proficient and certified in this type of work. But what's great is that this work is out there and it's slowly changing the way we treat our people in our country. Getting people healthier and better is really what it's about. Before I leave, though, we're going to talk a little bit about some things you can take home. If you're getting everything back from your doctor and everything's normal, but there's something still wrong, here's a few things that you can do. Get checked by somebody who's knowledgeable in this work. Find somebody who has the training and background in functional medicine, functional nutrition. Integrative medicine is a term you might hear used from time to time. Have the labs done, all of them. Sometimes you have to dig a little deeper to find the problem. So the labs are pretty invaluable. There are tons of labs. We go above and beyond too when we're checking for stuff. We use blood, we use urine. Those are very common, but we also use things like stool, saliva, we use hair. These advanced tests look for things that are usually not being sought after in a normal encounter at your doctor's office. The other thing too is, if you have any structural issues, and when I say structural issues, I really mean with your skeletal and muscular system, get those checked. As a chiropractor, I definitely value the manual therapies that we do, the adjusting and getting that spine working the way it's supposed to biomechanically and allowing your nervous system to do what it's supposed to. Everything in your body is controlled by that nervous system. The other thing you could do too is take a pharmaceutical grade vitamin, a multivitamin. Take them every day. Get yourself a good fat soluble nutraceutical quality vitamin D. Take at least 5,000 IUs of that a day. Find out what foods you're sensitive to. This is another blood test. Having yourself checked against for food sensitivities is probably one of the best things you can do for your health in the long term. The other thing too is find out a way to manage your stress. Chiropractic is a pretty good way to manage stress, but what can you do at home? Things like meditation, things like deep breathing relaxation. Deep breathing stimulates a part of your nervous system that is responsible for rest and digestion. The other thing you can do is find the things in life that you love to do and do them with the people you love the most. You know, leading a well-balanced life, finding time to work, to spend time with family and loved ones, to be involved in church and civic organizations. That's what balancing your life is really about. You can't have balanced health without a balanced life. So thank you, everybody. If anybody has any questions, we still have a few minutes left. This would be a great time to come through. I'd be more than happy to answer them for you all. Again, at the bottom is my email address and my clinic number. What we're going to do with everybody on the email list is we're going to send you out a code if you are interested in having a consult with me online. We do this via Skype on a web camera or in another Zoom room, and we can talk about some of the things that you might have questions about with your health, and even make some directions and some professional opinions on what you might be able to do next. Again, thanks again. Any questions, please let me know.